great to see everybody. It's been a small meeting today, but it suits me absolutely fine because, as I mentioned last time, I really want to be working with you all to develop an even clearer narrative to help countries that need to find a way to avoid a third lockdown. We have countries in Europe now either in lockdown or going into lockdown all over the place. And minds must be focusing on the steps to be put in place to make it not necessary to be constantly living on a knife edge and slipping into lockdown whenever things get bad. So I'm really focused on that, just been using every single media opportunity I have to try to get the point across. And I would love to get your suggestions on language, just as we did last time. Many of you have been suggesting language in your communications on the WhatsApp group and by email. But first of all, I'd like to greet Peter Morey. Thank you very much for joining us. And secondly, I'd like to invite Twee to set us off on our way. Twee, you have the floor.
Welcome, good morning, good afternoon, good evening to you all. As usual, I launch a poll to find out who's joining us. So please follow the pop-up that you'll have on your window now. Answer the first question on where you're joining from. Scroll down, complete your age range. And then lastly, share how you're feeling today. And here you can answer multiple times. And it's our way of knowing how you're feeling despite being a virtual meeting. I'm going to leave that open and we'll come back to it later in the session. Thank you. Back to you, David.
Wonderful. Thank you very much indeed. What I'd like to do now is to just set the scene and help us find our way in. And perhaps the best way to do that is just to see whether or not I can, yeah, here we go. I did want to just once again show you what we're dealing with in terms of the global epidemic curve. You can see that we are in the middle of the third acceleration during this pandemic. I said that last time, but each week as we get new data, we're seeing that the third acceleration is really profound, driven by the consistent rise in the numbers of cases in Europe. And as we look across Europe, perhaps the country that's got the most dramatic rise in cases is the one where I live, France, which really is accelerating with numbers doubling in a bit over a week. I am getting information from other countries that this acceleration is occurring. It's very hard to be certain of it because of inconsistency on testing, fair enough. But the surge is occurring in Eastern Europe. There's a lot of COVID in Russia. It's occurring right through Western Europe. 40,000 new cases yesterday in France. 25,000 new cases in UK. Italy got a particularly troubling situation and is about to introduce strong movement restrictions. Germany, nearly 20,000 new cases. Czech Republic, high as well. So this Europe surge is right across the region and includes Scandinavia, Denmark, Sweden, and so on. The US surging in particularly some of the Midwest states. And I've just mentioned Africa as well. So this phenomenon of the resurgence is pretty widespread. Now, the death rates are starting to pick up. They're not going up so fast. Partly that may be underreporting. Partly it may be that the denominator for testing is just so much bigger and contains healthier people. We just don't know. And I'm quite relaxed now about saying there are things that I cannot easily explain. I'd rather do that than be coming out as though I or anybody else knows everything and then found wanting. So that's just my quick sharing of my screen. And I mean, under any other circumstances, this would be a global emergency. It's just that we are very distracted by other events going on at the moment. And there are a collection of leaders who are just trying to say that this is all fake and so on. So we're in a pretty bizarre phase right now. And one thing I can just say to you all is that if I talk to business leaders, whether they're in the manufacturing or in services or in finance and investment, particularly the food sector where we do a lot of work, they are super worried, and they're saying, what's 6 months ahead going to be like? What's 1 year ahead going to be like? And what steps can be put in place to try to help at least make that future a bit more predictable? And I answer, well, here's my view. If you look at what's happening in East Asia, there are some steps that you can put in place and must be put in place to keep this virus at bay and to stop it surging back. I've decided to put much greater emphasis on the need for public health infrastructure to be in place to provide defenses against this disease. And in our team, we've been talking a lot about public health, and we think that as a concept, it means something to people who know about public health, but it means absolutely nothing to others. And so we're thinking, well, perhaps we've got to find other language and get that language in place. So the first thing that I'm saying very strongly on what authorities need to do is the consistent and clear communication about rapid and robust local action to deal with spikes and surges of the virus. That phrase is very strong. Consistent and clear communication, because wobbly communication is so unhelpful. Rapid and robust local action, because all that we've learned from East Asia is that as soon as you've got a spike of cases, as soon as you've got a little cluster appearing, you just have to act, and it has to be done locally in the local context. And of course, you need intelligence about the spikes and surges of virus. Otherwise, you won't get it right. So I'm putting that right across the top now as an absolute requirement. Secondly, I want to get the right language for what we in public health community call surveillance, keeping a watch on what is going on in the community, and having a capacity to alert when there are spikes of a disease. I'm currently using the term web to describe that. We could use mesh, we could use net, we could use lattice. The trouble is that most of the metaphors for that are a little bit sort of restrictive. A net is something you catch people in. A web, that too can feel quite restricting. But it has to be there, and it has to cover the whole population. And so interconnected, extended web, not necessarily run by a government. It might be a little bit like the World Wide Web that we all use all the time, not a minimally governed apparatus that's capable of engaging with businesses, community organizations, and so on. But that capacity for having a health alert web that is very close to where people are is something I want to get across. And I've been trying it in lots of different venues last week, because I know from looking at Singapore and Vietnam and Thailand and Cambodia that they have this capability and they use it. And that's what it picks up early spikes, and it picks up surges before they grow. And it's the key, because without that, you don't know what's going on, and you can't do it all just with mass testing, even though one would like to. It's actually economically not possible. You can use tests to support what is essentially a detection system right across society. And then above that is the professional capability at local level to investigate, to interrupt transmission, to suppress clusters. That's where you do need people with authority, a little bit of a metal edge to the ruler that just says, you know, if there is a spike, we've got to find out what's going on. We've got to find out who is at risk. We've got to find out where they are. We've got to find out why they're getting their COVID. And we've got all sorts of ideas of which living conditions and which occupations are high risk, but there's no substitute for this detective work to investigate and then response work to interrupt transmission. And that's where the contact tracing comes in. And of course you do that, especially when your numbers are low, because without the contact tracing, you can't understand where the chains of transmission are. And then the next sort of reserve line is an integrated incident response team that's at the ready, that can mobilize different groups of actors in the community, mobilize the religious groups, mobilize the sports clubs, mobilize local businesses, mobilize actually volunteer responders, so that if you've got a surge turning into an outbreak, one of these big ones that's causing a lot of sickness and situation like we've got around here at the moment, where you just can't get into hospital unless you're really ill. That incident response team is key, but that needs to be led not by the health people, that needs to be led by the local chief executive of, for example, an urban government, chief executive of a province or state. And it's that function that we really value, of having an individual who is responsible for making sure that everything works. It's one of the few times when we try deliberately to put everything onto one person's shoulders. And I think that having a person at the center of this incident response team that brings different actors together at local level really works. All the studies that I'm doing of places that are performing well on this put so much emphasis on these integrated incident response teams. And then all that, whether it's the community level health alert web, or the local capability to investigate, interrupt transmission, suppress clusters, or the incident response team that can act when things are bad, all that needs support. And the support is really mentoring. You know, my experience of doing it in other places is that you need to be ready to go and work with the people at the local level who are forming their incident response teams, and just help them through the mess, because these are always messy. You're having to bring together people who perhaps haven't always worked together recently in a nice, comfortable way, people who got a background of political and institutional argumentation that's gone on for years. And so the mentoring support, the cash support, the surge capacity to bring in extra resources if things get overwhelmed, that's what the regional and national authorities are all about. Is this too idealistic? Is this too idealistic for Western Europe? Is it too idealistic for the US? I don't think so. And this is what is being done all over Africa at the moment. That's how it's working. This is what's being done, and really, I think, very, very nicely in so much of South Asia. It's what's second nature in much of Latin America. When stuff is bad, people come together and work as an integrated response team. So this is the syndemic, as Rebecca wrote to us in an email recently. It's part of the together lifestyle that we're working towards. And what I'm trying to do with John today, and with Catherine today, and with William today, is to find the right language to use to describe these essential elements of community level public health action, so that we can actually start talking about it, you know, looking at each other in the eyes and saying, we want to avoid a third lockdown in Europe. There are some steps that have got to be put in place. There's really no alternative, if you don't have these defense mechanisms. Now, all this must be accompanied by the continued effort to encourage people to do the right thing, because that's what they ought to do. And there's lovely, lovely evidence that collective behavior shifts are happening all over Europe. You know, the numbers are not pounding up at the rate they were. And the death rates are not terrible either. I think hospitals are being much more efficient and effective at dealing with COVID than they were in April, May. And it's beautiful. There's real learning going on. And there's also a high level of protection of people who are at real risk. And so all I want to do is to work with you all to encourage continued physical distancing, mask wearing, hygiene, and self-isolation as soon as you have the slightest hint that you've got the problem, plus protecting those who are at risk, these kind of big five in the do-it-all group that Tedros talks about. And I'm going to say, well, when the vaccine comes along, that'll be a sixth. Don't assume that the vaccine will somehow mean that we stop doing these protections. And then lastly, I keep coming back to the importance of the kind of leadership that is necessary for this kind of thing to happen, collaborative, compassionate leadership that connects with people, and we will keep that going strong. So we're going to try really intensively to push this package messaging everywhere. We were calling it a month ago the campaign. We're now just saying this is the avoid a third lockdown message. And I've just done an interview with MSNBC. I'd be amazed if they can put anything on the telly, given that everybody is interested in whether 264 goes to 270 or not. But I'm hopeful that we can squeeze into the interstices of the election coverage. It just has to be done. And I was seeing that Tony Fauci, a redoubtable, brave US public health doctor, giving a seminar in Chatham House soon, and is really being very clear. He's sticking with the message. Tedros is sticking with the message. Mike Ryan sticking with the message at WHO. And a lot of other different actors trying to keep this message going. You want to avoid a third lockdown, put the elements in place. And even if it's difficult politically, do it. Don't muck around, because businesses, people, communities will suffer horrendously if you can't get these steps into place. I'm just looking, I see this is a really good group on people who have been working on this. It's mostly our team and some very close friends. I'm actually going to invite everybody just to help us. We've got an opportunity to get something into UK weekend press, and we want to take advantage of it. It doesn't come every day. And so this is a shaping exercise to try to get us all into the same space. Let me now in the commentary, let's try to look forward, not so much looking back and finding fault with what's happened, but look forward and saying, this is what has to be in place. In the UK situation, we are able to connect with local leaders from some of the cities. We are able to connect with even some of the national leaders. The connections are much, much better than they were 2 or 3 months ago. And so help us, and we don't have unlimited opportunities, so we have to make sure that we get the words right all the time. Just John, am I all right in the way I've framed this? Do you want to add anything? And then I'm going to go to people who've got their videos on first. John.
No, I think you framed that really well. I liked that sense of getting the comms right. What is this local presence? What does it look like? We have good community groups in the UK, but how do we engage them and connect them better with the other levels of that you were describing? How do we connect them better with the medical, clinical, professional capacity around investigation and tracing? How do we connect them through to city leadership and instant response? And I think that would be something I think worth exploring. So it's not that we haven't got lots of the bits and pieces. It feels to me that we have yet to step up our level of organisation and the relationships between the various bits in order that they work better. So I'd be interested to hear what people have to say about that and maybe reflect further towards the end, David.
Thank you. Brilliant. Just checking, I can see Sarah, Rhiannon, Annie, Marianne, Haruko, and would like to call on you all. The order, it really, if you want to come in quickly, just turn off your mute and that's a sign, or wave at me. Annie, would you like to come first?
Thanks, David. I really agree with your view and what John has just said. We do have these gaps, and I know that that's looking backward, but looking forward, I mean, certainly across Essex, we are building this up with the links. And in Colchester, we've got a group called One Colchester, which for more than a couple of years is state, non-state and commercial coming together. And what's really interesting, certainly where I'm working, we do have growing links with health and the NGOs. And I think that's excellent, and that comes out of work we've been doing. One of the things that's really struck me, though, is that actually when you're turning these liners round, it takes a while. So there's a tension between the emergency response and actually to make an institutional response that takes longer. There are then at a point, we have got several good opportunities, which I won't go into because it's too long. There is a point then which you need enabling support from central government.
Yeah.
We all know that's difficult. On the language side, can I say that there's no fixed vocabulary? I agree with Marianne about the cultural differences, and it depends who you're talking to. And even with different political leaders, it depends who we're talking to.
Yeah.
And can I put a request in which had only just occurred to me, which is we had a very interesting and useful session on schools.
Yeah.
Could we have one on local leaders?
Mm-hmm.
Bringing in local government and joining that up, because as you know from the development side, you're always worried that you're going through these same processes and repeating yourselves. So some joint learning might be great. Very good.
Oh, that's a super idea. Thank you. Trying not to take up time by talking in between. Who's got their video, their sound off, just to indicate they want to come in? Sarah Phillips, please.
Hi there. I was speaking, I'm over at the uni and we've moved rooms to get more COVID secure and stuff. And it's all sort of sealed in. I'm in another box. But I was over at the canteen and the cafe, it's a staff cafe, and talking to the staff there. And it's interesting, they're all frightened. I've met them a couple of times when I've been over, and I just feel like it's the feet on the ground, the local leadership. And the lady said to me, she said, "Oh, well, I don't understand what's happening." It was just before the announcement in the UK. I don't understand. They're all clever. Why? They're all clever. What's happened? And I said, so I sort of said, well, you know, but what you know is, you know what to do. You've done brilliant. They've done amazing at the uni. All these things that make it COVID secure. I said, some of it's about practical, isn't it? And getting these things there. And so I said to her, my friend, and she sort of laughed, but I said, would you want, and I said a certain person, would you want that person to come in and take over your restaurant? And she was like, no. You know, but these people, it's often like that in nursing and healthcare organisations, it's the feet on the ground. So for me, talking about local leadership and empowering that, and it's borrowed authority, borrowed leadership almost. So there's that feeling of empowerment, because whilst she'd done, and loads of people at the uni have done so much stuff because there's infrastructure here and there's leadership, there's a feeling that they can't, but they're doing it really well.
Mm.
So that's my comment, and I'm talking, so hopefully you can make sense of it like you do.
Yeah, but I want to know from you, what is the word, phrase, look in the eye, whatever it is that helps the lady in the canteen to feel that she's done something really good and that her contribution really matters, because there are millions of these people all over the world doing their little bit, and it all adds up to something amazing. Okay, it's not enough to hold the virus back as much as we'd like to, but just imagine there weren't all these people doing this stuff, just what a mess we'd be in. And so I really like it. Anything more you can share on the kind of words that had meaning when you were talking would be lovely. Feet on the ground, they're the leaders, that sort of language.
I just say one thing that she didn't know. Lots of people don't know. They just aren't aware that they're having an impact.
Yeah.
It's incredible. And you're like, wow, this is just outstanding, you know. So, yeah, thank you.
Well, thank you for telling her. Okay, going along. Rhiannon, you've got your thing off. John wants to speak, but...
Just quickly coming back to Sarah. Sarah's comments, David, reminded me of an experience I had as a young army officer, where I had a colleague who was an Oxbridge graduate and incredibly bright. And I said to one of the soldiers, isn't it great that we got this guy? And I was said, well, it's probably the brightest man I've ever met, but he's no bloody use. He said, he's got no common sense. And I think we play in too much in COVID too. There's going to be a brilliant technological breakthrough that's going to save us. And I think if people just get a little bit of if we can give people self-confidence that their common sense, their everyday activity is probably the biggest thing that makes it. We break the chain of transmission by how people are with each other, not by supermodeling somewhere in Whitehall. Cool.
Thank you, Rhiannon.
Yeah, I always get criticised for not having any common sense, even though I go to Cambridge. Yeah, so I was thinking with the messaging, and I spoke to Three about this like a couple of weeks ago, but haven't managed to send her what I was working on. Basically, I think it would be good to frame it in terms of two overall objectives of the messaging. So I think objective one would be like actually understanding what good public health is and understanding what it looks like to be COVID ready. This is useful so that people know what they can do themselves, but it's also useful because you can then hold people accountable to that as well. And you can ask, because like most people in the UK agree that our response is really bad, but they don't actually know what a good response looks like. And I think that's quite frustrating for lots of people. And then building on that, but then kind of a second objective of the messaging could be to give people something to aim for and hope for, because like, I think lots of the European responses are completely directionless. And that's still a factor because they don't understand what good public health is. But not having an aim and not having an objective is also its own problem in itself. Because then that's not an enabling environment for people to use their own capacity and resources towards these aims because they don't know what they are. It's hard to bring in voluntary and private sector when they don't know what they're being brought in for or why, and people are incredibly disempowered. So even though it's a function of the fact that we don't know what we're doing, it's kind of its own problem as well, that people need something to aim for and work towards, and we need to be able to imagine the state that we do want to be in. So I think those would be like my two priorities for the messaging.
Super important, something to aim for, just to hold that. It's My friend Yania Bar Yam says you've got to go for COVID zero. You've got to actually help people to align behind the idea you just get rid of the virus. And I'm saying that's a step too far. He's saying if you don't do that, there's nothing to aim for. I like it that you've put your finger on that one. We're just going to go no massive order except how your images come up on the screen. Just tell you, Marianne, William, and Holly, I think, has appeared as well. So Marianne, please, thank you.
Okay, thank you, David. The first thing is, could you please make sure that you're very clear about what you mean about lockdowns?
Yeah.
Because when the Prime Minister of the UK quotes you in Question Time, I would say misquoted you.
Yeah.
It's not helpful.
Okay.
But just to, one thing about Europeans is our cultures are very different. We don't really like doing what we're told. And I think we have to take that into account as a starting point. We don't immediately go and do what we're told. We try and work out how we're going to do something else instead. So culture is important when you're looking at Europeans, and particularly when you're looking at the Brits. We know that very well. But public health doesn't mean anything. Public health is them, it's not me. Public health is out there. It's drains, it's sanitation. People, unless you have some health background or anything else, don't necessarily get it. We know about general practitioners, but we don't necessarily know what on earth public health is. Yeah. And this is one of the things that we've been shown recently when it comes to, I know Rhiannon's not going to agree with me, so that's, but it is a real problem. Yeah. The messaging still needs more clarity. Yeah. I'm not sure what on earth we're meant to be doing in lockdown here. And from a little message I had with, at the moment, with Annie, her interpretation, mine seemed to be a bit different. I don't know if I've got a bubble or not a bubble, because there are two people here and not one, and it's just confusion doesn't help. We need simple clarity, and we don't all have a degree. Some of us are illiterate or uneducated or left school when we were 15 or whatever. We need to be very clear, quite simple in what we're saying. That's why we can wash our hands. Yeah. But when it gets more sophisticated, we don't get it. And the other point is, and I put in the chat, we have to make the links when it comes to the economic perspectives. Yeah. It does at the moment. I don't disagree with what you say. We've got to get the public health right. But at the same time, we have to take into account and look at both sides of the question. And I think what we're doing is possibly the best we can at the moment, but I'm sure that with collective brains and pushing things, we can do better. Thank you.
Marianne, thank you very much indeed. I love it when you say Europeans don't do what they're told. I wrote in my notes, Europeans are fundamentally anarchic. And that may be true. I see you smiling. You also put Brits in a pretty extreme position. So that's very important as well. After William, I'd like to go to Haruko, if you'd like to speak, and then to Holly. And I'm making a list, so don't hesitate. Put something in the chat or just turn off your mute and then I can pick it up. William, please.
Okay, one or two things. Firstly, I think we need to be really specific. Examples, case studies. What do we mean when we talk about local action, when we talk about public health-led action? What in practice does that mean? Because otherwise it's just slightly vague words. So I think a lot of really concrete description of what we're talking about, first point. Secondly, I think and it goes with that, the niceness, the discussion of community action, of people pulling together, people communicating with each other and so on, all of that is great, but it is a bit of a distractor. What we actually need to focus on is concrete actions, and particularly the measures that government agencies can take to enable those actions. We need to move away from central government actually obstructing the development of local capability to a situation where it becomes a supporter and an enabler. And the financial support is a really good instance in that case. And my last point is messaging.
Yeah.
I mean, we've got this catastrophe at the moment of even our own Prime Minister saying that the restrictions that we are now under are a tragedy, and he doesn't like them. We've got his party fighting him over it. In order to create a sense of common purpose, we've actually got to really get discipline among those who communicate public messages to try to minimize the confusing effect of that cacophony of mixed messages. That's my point.
Thank you very much. There's a lot in that. Thank you, William. Going on, Haruko, wonderful to see you, Haruko, and I hope all is well. Let's hear from you now.
Hello, everyone. I'm Haruko from Tokyo, and I finished my master's degree in international public health last year in Liverpool. And well, I'd like to follow the message from, how do you say, message from Marianne in terms of cultural difference. I've experienced the life in UK last year, and now I'm in Japan, and I can see the big difference among the population. And it seems like cultural difference has the, how do you say, the stronger effects on the people's actions, rather than leaders' communication method. Because, for example, Japanese people are okay to follow what we were told by the central government. We're generally okay. Some people don't want to follow the how do you say, the prime minister's messages, but those are the minorities, and people in Japan generally behave well, wash your hands and keep distance and avoid close place. And well, of course, the message from the central government is also important, and I think especially the Tokyo governor.
Yes.
Yeah, her message is really clear and very easy to understand.
Yeah.
Yeah. So yeah, I like her attitude and method.
I heard her just 3 months ago, and I thought everybody who hears what she says knows what they must do. She speaks with total clarity, whether she's speaking in English or Japanese, as far as I can tell. And Haruko, what do you do when you see somebody on the metro or in a meeting not practicing mask wearing and distancing and other things? Does it make you angry or sad or what?
It's quite rare to find a person who doesn't wear a mask or who doesn't wash hands. Personally, I'm working from home, so I just go outside on the weekends. And last week I went outside, and well, almost 100% of people were wearing masks. It's amazing.
Thank you very much, Haruko, and thanks for reminding me that we met in Liverpool and the relationship between your time in Liverpool and your time now back in Tokyo. Please stay close to us. I've got in my list I'm going to ask Tracy if she wants to come in. It's up to her. Holly, I've written down before Tracy, so it'd be Holly next and then Tracy. I saw Claire French was on. Claire, if you want to come in, please just let us know. And anybody else, we're trying to work through the messaging. Welcome to Joe Nurse. Holly, please.
Morning, everybody. Thank you, David. Quite a few different thoughts. So the first one, just relating to what Harushko said, is I had an interesting conversation with the civil servant's take on the fact that we don't do rules here. And she said, well, if you think about how our law system works, we have a set of laws, but then you go to court and you argue mitigating circumstances effectively, but actually in this situation, these things were going on. And I thought, oh, that's quite an interesting way of thinking about how our psyche works collectively. And it just made me realise something this morning when people were talking, is that our media has a massive kind of commercial infrastructure around human interest stories, because we are really interested in other people's perspectives. So even some of our experts now, or people that get presented as experts, are actually really about the human aspects of whatever the subject is we're talking about. So if you think about drugs or even allergy responses, often the people who were involved in that scenario, so the parents, become almost experts in the situation. So I was wondering if there's something about, as well as the process of imagining hope and where are we going in the future, you also have a process of imagining the worst case or the difficulty, but you can do that through human interest stories. So talking about specific people's examples of having COVID or infecting other people. So I don't know if you guys remember, a few months ago on the briefing, someone talked about her own experience of having her family all come to dinner, and then someone in their family went home, took it to another member of the family, and the family died. And those sorts of stories really stay with you. So I think there's something about how we create stories or support the media to do more human interest stories, because that does seem to connect with the population. Yeah. It does make it more real to them in terms of what the consequences are if we don't do something.
Yeah. So,
and then in the terms of making hope, I absolutely agree that we have to create a narrative that's about the way out of this, and that's clearer, and people can see the sequential process of this is the way out of this, and this is my contribution. So I think that's my third point, is that I have heard several people talk about this, is that contribution and what do I individually contribute is both not clear and not visible to people who are actually doing something. So having a really clear set of things, these are the things that you can do. And I really liked what Sarah was saying in terms of the kitchen staff and the canteen and them not realising what they're contributing. So again, surfacing those stories and enabling people to see that they are making a contribution. And although it's annoying to have to stay 2 meters from people, they're with it.
Yeah.
And then the fourth thing, if that's okay, is just to say that the places that I am finding most receptive and who are willing to make a big concerted effort to step outside of their comfort zone are the local infrastructure organisations who are organising local third sector groups. And the one that I'm working with has come up with a brilliant idea of story exchange.
Yeah.
So does that...
What do you mean by third sector? I think I know, but just I want to be sure with...
So it's like the combination of the voluntary sector, the charitable sector and the community. So really small grassroots sort of organisations. And so they've been doing things like coordinating volunteers across geography, or the thing that I really like they're doing at the moment is trying to organise this idea of coming together while being apart. So two individuals telling their stories of COVID to each other in a sort of podcast style thing, so that they can bring the community experience in conversation together, and people can feel a bit more connected, even though they're not allowed to be in the same room. So it's a bit like the conversations you had in the pub at the bar that you can't have at the moment, is the idea.
Very good. Brilliant. Those were everybody, unless if you, please go on, because all of these help us in shaping, and there's so much richness about stories, narratives, way out. And also this lovely point, we don't do rules in the UK. There's a bit of a celebration of British anarchy here. Let's go to Canada, to the West Coast. Tracy, hope you're well, and you were going to talk a little bit about what's happening. You've got a soundbite, Chair.
Yes, thank you, David. It's a bit late here, it's Thursday evening. So, yes, so our numbers are very high, and I'm hoping that it will really wake people up. Yeah. Our public health reports we get basically every day, written or verbal, 3 times a week. And they always come up with a new soundbite. So in the middle of October, we had our Thanksgiving celebration. So a lot of families get together, have parties, gatherings, and so on. And 2 weeks in, from there, the positive rates are higher than they have ever been since the pandemic began. It's really quite disturbing. Yeah. And one particular, so our public health do share stories, personal stories. And the one was that it was a small family gathering of 10 people. And I think it was like 8 of them were tested positive. And one of them was the grandmother, 80 years old. And she was taken to hospital, and unfortunately she passed away. So, it is family gatherings that are at risk as well. So our public health soundbite for this week regarding parties and gatherings and so on is don't go, or don't throw a party. Don't throw, don't go, and say no.
Wow.
And so these sound bites that they give us every week or two really seem to have an impact, and people talk about them. So I think the talking part of it is really important. Yeah. And, I'm hoping that there's going to be another sound bite next week, after our Halloween, October 31st gatherings, which were horrendous, with a lot of young people marching down the street and not wearing masks, and it was just really upsetting. Yeah. So we're expecting large numbers then. And we're hoping that these young people who think that they're invincible will become more mindful and respectful of each other. So yeah, that's basically what's going on in British Columbia.
Thank you for sharing the soundbite idea. These are all ideas about how messages can touch people, and we're getting some super good ideas. Thank you also for stressing that you're getting these super spreader events. As you get more and more cases, you can't do the really intricate contact tracing that one likes to do. It just becomes too difficult, but you can work back from spreader events and try to establish how they started. And then you get these very rich descriptions. The sad one, of course, in the case of your 10-person gathering that you mentioned, but more and more we're finding it is these events that have the spreading consequences that you describe. And thanks again for connecting with us. I appear rather late at night. It's really kind of you to say.
Yeah.
And
well, I'm sorry that I can't join. I'm not very computer literate, so this is the best I can do. So I can't really stay in touch on Twitter and those other venues.
Thank you very much indeed. And I'd like to keep going. Louisa Novke, you got some ideas that coming from the business sector. Off you go.
Yes, and I'm frantically typing in the chat, but I can continue what I have in mind here. So we were talking about small businesses taking ownership and letting them take ownership over the response. So the story that I've experienced myself is of a very particular gym chain that used to do circuit classes where everybody would share the same equipment over a 45-minute exercise class. Yeah. And they had to completely rethink the concept of how their classes are run, how they can keep their members safe, but how they can stay open as a business. So they had to reduce the class sizes by about 50%, tape boxes on the floor so that everybody would stay in a 2x2 meter square and have everything they need for the class in this little square. So no sharing of equipment would take place. What I'm thinking is, like Sarah said, people that achieve these milestones are not really aware of how well they're doing and how much leadership they could provide to others by telling that story. But how did I manage to survive in COVID? And I think we should maybe involve these stories more in the response and in the messaging.
Beautiful. I love it. But I notice your concern that it's massively demoralizing for those who try to do things.
Yes.
Then to have to go close.
But even despite that, when the first lockdown happened, most gyms came up with online classes. They kept their members motivated. So, but yes, this second hits them harder, I think, because they did so well. And now it's like it's not their fault. They did everything they could, and now they have to close again. So that's super frustrating.
Big frustration. Others. Phil Dearden, would you like to make any comment? I see you nicely videoed, and I can't resist inviting you to come in.
Okay, thanks, David, and thanks everybody. I was just actually writing a comment in the box, actually, but I'll say it. Let me quickly start really by saying, going back to Sarah's point, talking about in the canteen, really around the idea of informal leadership and devolved leadership. And I think in terms of language, those terms we should be trying to push a lot more than we are. And just to illustrate this, a very simple story from my own university. A couple of weeks ago, our Vice Chancellor put out a video message to all staff, basically putting up his hands saying, I'm running out of ideas of how to run this place. Yeah. I need your ideas. And he put it out to all staff as to how we're going to cope in this semester to get through to Christmas. Yes. And there was a mass of really, really good ideas that came from staff across the institution. And it was really, really positive. Having said that, a number of staff thought, gosh, our leader's lost it. He has completely lost the plot. He doesn't know what to do. But in fact, it's been a really, really positive story. So informal and devolved leadership, put it out there, ask others for their ideas, as we've been hearing, I think is very, very valuable language. Let me stop there.
Phil, thank you very much indeed, coming in from your university. What time is it where you are, Phil? Can't hear you.
8:30 now. We start 7:30, but that's usual time here.
Thank you very much.
Nice to be here.
Very good to welcome you. Claire French, moving towards the end now, but I've been wanting to bring you in, Claire, and you've written this giant thing in the chat that I can read, but you might want to, because it builds on what Phil has just said. Claire, please.
Hi, David. Yeah, there we go. I'm in coat and hat because I'm just about to go out and meet the children at the gate. Yes, I've just been watching this and we're talking about, the ownership and local leadership taking these things on. And yesterday, we've had a few cases in parents and one in a child at our school. And it felt that even though the staff were desperately trying to stay there 2 meters apart and go to, great lengths in the staff room to make coffee at 2 meters, there were some times where this just wasn't happening, and it wasn't because people weren't trying. And yesterday, with the new UK guidance coming with the 4-week lockdown, we've decided that even though primary schools and teachers have been advised not to wear masks because it can it can be upsetting for the children, I think is one of the reasons, and because it can cover our mouths as well, we've decided to go against the guidance, and in communal areas, like they do in secondary schools already, we're going to have our staff wearing masks. Obviously they won't do it when they're teaching the children, so they'll still be able to hear the teachers clearly. But just to protect the staff from spreading it amongst each other, because from what I can see here, that is going to be the greatest risk for us. So we've put that in place. And yesterday I consulted with my SLT, asked them for their thoughts. So we put all of the reasoning in and all the explanations, sent that out, and we've had really good buy-in and lots of support from other members of staff. So it's been great.
Very good. Claire, you are absolutely amazing, our role model teacher. Thank you again for what you did just before half term. Thank you.
Oh, you're welcome.
Staying in touch. Give a big hug to all you can't do it, but give a virtual hug to all your parents. They are part of a wonderful experiment of devolved leadership, and you are a brilliant leader. Thank you again on behalf of all of us. Everybody, I want to go back to John before we close to try to pull strands together. I want to just say, if anybody else in the team wishes to come in as well and offer, they're welcome to do so. I'm looking over the top of my computer at Catherine if she wants to. But before we do any of that, let's go to Peter Morey. Let's see your screen, Peter, and find out what you felt of today's conversation. Ah, that looks nice. Peter, tell us what it is.
Hello. Okay, so I started in the top left with the surge continues worldwide, and you can see all these circles connecting up. Some of them are key actions, and then you talked about behavior change and pushing that and keeping that message consistent. And then we have a big thing in the middle about integrated incident response teams and the leadership of those. Yeah. And then right down on the bottom, we've got this image of the cafeteria, which I felt was really strong. And then on the right section, we've got this question of building public health infrastructure and then using the right language to communicate that.
Thank you.
Thank you. I hope I captured it faithfully.
Nice, that middle part, these integrated incident response teams, they're super local, and I feel that that's in there, and it's nice. Gosh, I like it. Thank you for showing us your trade and giving away secrets.
Thank you very much.
Good.
Cheers. Pleasure.
Let's go to just for the anything about the survey and stuff and any announcements.
Great, I'm sharing the results now. The majority of people joining from Europe today, with a couple from East Asian Pacific area, which is good because that's why we hold these at this time of the morning for us. In age range, again, great to see people across all age ranges. And then today, like last time, we actually have most people feeling positive, having positive expectations and belief, which is good and a good step up from the usual optimism and hopefulness we have, so even better. Still one person in the group there who's feeling a bit of grief or despair, so thoughts with you. And thank you to everyone. Fascinating today. Loved the mention around human stories, the local heroes, and got me really thinking about what we can do in these sessions around making space for all of those, because with movement restrictions, we are less able to be able to share those stories in our everyday lives. Thank you. Back to you, David.
Brilliant. Twee. John, please.
I think this has been a really, really valuable conversation, David. I think the thing that I've got from it is a way perhaps to try and describe better what we've been calling this web. I've liked this idea of it's like the World Wide Web. It doesn't necessarily need someone to tell it what to do. It needs a few fixed points. It needs some money in some places to make it work. But this sense that this is good people doing good stuff, common sense, and it can be community and volunteer and sort of informal groups. It can also be small businesses. It can be large organizations, all making sure that people understand what's going on and keeping a watch out for each other and for what's going on in their space and making that visible and connecting that then into those bits that really do need the hardwired infrastructure of health professionals and city management and all of that sort of stuff. But I think it's been a very valuable conversation in just surfacing what we mean by all of that. So great for me. Thanks, David.
Great. Thank you, John. On behalf of all of us in the team, we are immensely grateful to everybody for finding the time to join. We hope that you benefit from it as much as we do. We will be trying this weekend to pull stuff together. Words are never good enough to convey the feelings that have come through. But John, I felt that the way you are doing it just now was really beautiful. And I'm so pleased that the chat has been very active. We have to stop now because it's just past the hour, but on behalf of all of us to all of you, big fondness. Let's stick together, join ourselves up and be strong. We all need to actually be looking out for each other, as we've said. So thank you all, and just say bye-bye.